So in this video, I'm going to be talking about what kind of skills a doctor needs. So in your interview, whenever they ask you questions like, what kind of qualities does a doctor need, or when they ask you about your personal statement, they ask you about your work experience or just your hobbies and interests, you can use that as a way of talking about the skills our doctor needs. So in your work experience, the main thing they're looking for is, have you acquired or have you gained an appreciation for the skills that you need as a doctor from your work experience, or just whatever you put on your personal statement. So even things like hobbies, it just shows, you have a balanced lifestyle, which is important as a doctor. So the first thing is leadership, but also being a good follower. So one of the questions they ask, or they can ask, is, are you a leader or a follower? Really, it's a trick question because you should be both. A good leader is able to work alongside the team. They know how to make decisions and lead a team, but also they're skilled enough that they recognize any weaknesses that they may have in a particular area. So they recognize their limitations and they seek advice and assistance where needed in those limitations. For example, you might be a diabetes specialist, but let's say one of your patients now has they've had a stroke. Now as a diabetic specialist, it's not obviously within your realm to be dealing with a stroke per se. You might know the basic management, but likely you're going to want advice from a stroke specialist. So as part of the diabetes, you're managing the team, you're leading the diabetes team. But when it comes to the stroke element, you now follow someone else's advice. So you let someone else lead the management of the stroke. Communication. This is pivotal. You communicate with your colleagues, your patients, and just anyone else. As a doctor, it's a very, very social job, so you need to learn how to communicate. Communication is also very important when you're dealing with say a serious situation like an emergency. If you need urgent advice from a colleague, you need to be able to do what's called an SBAR. SBAR is a form of handing over to a colleague. So it deals with certain things like situation, background, assessment, and then recommendations. So situation and background are essentially, there's a lot of overlap. It's just explaining what the patient's there for and what's been going on with them. The assessment means, what have you done or what are you going to do for the patient? And then recommendation is just asking for advice from the colleague. So this is what SBAR stands for. And if you have good communication, you'll be able to deliver a good SBAR. And a good SBAR allows your colleague to gather the information needed so that they can give you the appropriate advice. So the next one is resilience. Being a doctor is a very difficult job. It can be very stressful at times, especially with the way the NHS is at the moment. It's very underfunded, very understaffed, yet very overloaded with the amount of work that we have to do. So you need a lot of resilience to get through medical school, which is quite intensive. Then also have that resilience to be able to get through these, difficult situations that you can be faced with. Empathy and compassion. So that goes without saying. You're dealing with people who are obviously suffering, so you need to be able to put yourself in their shoes and recognize that, to be able to actually have that care for them, especially when you're under stress. You may be tired, you're overworked, you have your own problems like we all do, but you have to be able to somewhat put that aside to recognize that you have someone who's suffering in front of you and you have responsibility, a duty of care over that individual. So just having that empathy and compassion is very important for you to be able to do your job properly. And the patients feel it as well. When you have colleagues who don't really have that empathy, they're quite cold, the patients feel it and it can affect them as well, and it can affect your rapport. Whereas when they see that you care, it's a lot easier to build that relationship with the patient, and it's a lot easier to get them, if you have any advice you want to give them, it's easier for them to follow it, or they are more likely to follow it, they're more willing to follow it, and they're more likely to give you the information that you need to help you make the correct diagnosis and management plan. So problem solving. Any problem that you come with, you're obviously trying to solve the problem. it's basically like being a detective. You're gathering bits and bobs together, so the patients, what they're telling you, then you have the blood results or any other investigations like chest x-ray, CT scan, and you're putting it all together to solve this problem and then come up with a plan. And then if that plan doesn't work, what's your next plan? So it's always thinking about how to fix the problem. Or even if you can't fix it, what can we do then as a way? Say for example, if you can't cure the patient, okay, well if you can't cure them, then maybe we can at least provide symptomatic relief. Then there's multitasking and prioritizing. As a doctor, you've got many jobs to do. You've got many patients. You might have a patient who's very unwell, or maybe even several patients who are very unwell. So it's your ability to prioritize each task, see which one needs to be seen more urgently or who's deteriorating fastest. So there's a thing called the observations. So this is used to give the patient what's called a news score. A news score just says how unwell that person is. So it measures your blood pressure, your oxygen, your temperature, your heart rate, your respiratory rate, and I mean those are the main 5, but they can also measure your sugar levels as well, as low and high sugar levels can often trigger these other factors that we look into, like respiratory, heart rate, etc. So looking at these things, and then even things like blood tests, any investigations, seeing who needs to be seen first, who's more likely to die first. So you can be faced with these very critical situations and you need to know how to prioritize to save as many lives as you can. Then there's being insightful. So obviously when we deal with very difficult situations, we may make mistakes. So it's your ability to recognize those mistakes and reflect on them. And even if you don't make a mistake, it could be you saw 3 people and maybe you felt you could have been more efficient in how you saw them. Maybe you ended up staying late and just reflecting on why that happened. Was it because you were overworked, or do you feel like you could have been more efficient with the job? So as always, we require reflection, and throughout your med school and throughout your medical career, you have to constantly update your portfolio. So portfolio is just a record of your reflections. So you need to show that you have the ability to reflect on anything that you did well, and also things that you could have done better. Then you have time management. Obviously it's a stressful job with many different tasks that you need to do. So to get them all done on time, you need to be able to manage your time properly. You need to know how much time do I give to this patient versus how much time can I give to the other patient. And especially the tasks, because you'll be expected to do your portfolio, for example. You need to attend teaching, then you yourself might have to do teaching, so it's just balancing all of these together. Attentive. This is very important. Many mistakes happen because we don't pay attention. For example, a drug is prescribed that the patient is allergic to because we didn't read over the allergies. Or a patient has, for example, they've been given a course of steroids. They had a course of steroids for the last several months. They're not having it now though. But if you read the past medical records and you see they've been on a long course of steroids, and then you notice the patient has had, say, a bone fracture, steroids weaken your bones, or there's a risk of them weakening your bones, and so increasing risk of fracture. And so in seeing that, in paying attention to that, it can help you make the diagnosis. So there's many small bits and bobs that can help you figure out, or to help you in your problem solving. Emotional intelligence. There's many situations where you might be dealing with a very angry patient, a family member of a patient, who's putting in a complaint, or there's been some misunderstanding or something, or just a patient that, you've given them a diagnosis and they're not sure how to take it, like you diagnosed them with cancer. In this situation, it's very important to be able to recognize the emotions that people are facing and to be able to adjust your body language, your choice of words to match the energy that the other person is feeling, or to help them tamper down that energy if needed. For example, if it's an angry patient, to help them calm down. So it's just recognizing the emotions in the immediate environment. Then there's just being balanced. So being a doctor is obviously, as I've mentioned, is very stressful. So you need to be able to manage your work-life balance. So there's the balance within the workplace of, what takes priority, which jobs can be done now, which jobs need to be done now versus which jobs need to be done later. Then there's actually balancing out your life. So being able to have hobbies, being able to keep a good sleep, hygiene, eating well, all these things, looking after yourself so that you're in a better position to look after others. So these are just some examples of the many skills that a doctor needs. If you just learn these, this is more than enough for your interviews. So I hope this was helpful. Please like and subscribe, and we'll have more videos coming soon. Thank you.